Assalamu alaikum, the communication day. First scenario. The scenario is lengthy a bit. I will try to summarize. She is a female elderly patient. Her name is Sandra, 81 years old. She was admitted with multi-organ and comorbidity. Her chronic comorbidity had some of the cirrhosis, cancer colon previously surgically managed. Later on, she presented with abdominal pain. Her daughter was asking for the doctor to meet with the doctor and to address the advanced care plan. However, the consultant advised not to be for critical care unit, to be as ward only admission. The daughter is waiting for you for 4 hours, and the doctor was little bit busy. Talk to the daughter and address the concerns. Okay, you can start, Doctor Lamis now. Here you go.
Right, okay. Hello, my name is Dr. Usman. I'm one of the doctors in the ward today. May I confirm you're Miss Julie and you are
Hi,
the
hi,
daughter?
doctor. Yeah, yeah,
Right.
uh,
And Miss Julie, may I confirm you're the daughter of Miss Sandra, 81 years
yes,
old?
yeah,
Right. Miss Sandra, nice to meet you today. Thank you for waiting. I
no
understand that you've
problem.
been wanting to speak to a doctor about your mother's condition, and I'm sorry that this has taken some time now.
Yeah, today,
Um,
yeah, yeah. I'm sorry. Yeah, you wanted to
right.
say?
So, is it okay to discuss your mother's condition?
Yeah. So today when I came, since I came, she has been having this tummy ache, and when I changed, her nappies, I found that she had some bleeding. Uh, Personally, I do feel it's coming from the back passage. But I think, as per the nurses, that this is the first time to happen.
Right. Okay. I really understand your concern about your mother's condition. Do you know some details about her admission and why she's being here in the hospital?
Yeah, she lives with me. I'm the lasting power of
Right.
attorney for her, so I know all of the bits and pieces of her medical background.
Right.
She's
Okay.
she's relying on my care, to be honest. And I am her. She lives with me, so I know everything about her.
Right, okay. I appreciate what you're doing, and I understand that this must be really frustrating for you.
Mm.
So during her admission, we have reviewed Miss Sandra. We have reviewed all the blood tests, the medications, and I've personally reviewed your mom's and examined her this afternoon. And she was having she was having a little bit of tummy pain and a tummy discomfort, and I appreciate that you're really concerned about this. But it
Doctor,
was
that this pain hasn't been assessed by the doctors, so this is when I came after the assessment, to be honest. So
right,
this pain has
okay,
just recently started.
right,
I don't
okay,
know if you've been made aware about this, but I've spoke already to the nurses, but um, this is something that's been happening whilst me with her for the last 4 hours, but I don't think that there is that she's been seen by any doctors at that time. But what I'm concerned about really is that could it be the cancer?
right. I appreciate your concern about Miss Sandra, but I'd like to reassure you that during she had her last cancer surveillance,
Mm,
and everything looked fine, so there isn't anything of concern. And also
hmm
during her hospital stay, we did evaluate her thoroughly, and there wasn't like anything concerning as a red flag symptom. And she's being medically optimized for discharge. So we were looking to discharge her this afternoon. But now that you've
mm.
spoken to me about those symptoms, then I would give her a look. But I think based on what we have seen and reviewed, things would be reassuring. And if there's anything like it would be something mild that could be managed easily. How
Yeah,
do you feel about
like what we can send because last time when we found that she had cancer, she had a bleeding, And since then, since she had the operation and the cancer has been removed surgically, the she never had this again. To be honest, she's not well communicating herself because of the dementia, bless her, but she this is my main worry, to be honest, is could it be cancer? Is there anything that can we can do to provide reassurance? Because the last checkup was 6 months ago.
Right, okay. Right. So, according to her notes, I can see that her last cancer call and surveillance was quite reassuring.
Yeah.
But before like making a discharge, since you have brought up this complaint to my attention, definitely we would consult the gut doctor and the doctor looking after her in terms of her cancer, and then we will see if there's like any need to repeat this. But it's
Hmm.
very unlikely that this have been like recently, like 6 months ago. But that's definitely something we would discuss, and I'll get back to you on that.
Yeah, but I think that those things can be arranged. Not, doesn't necessitate that she should be admitted for follow-up for that.
Right, okay.
Yeah, it can be because to be honest, we are trying to arrange her the package of care, and these things can take time, as you are aware. Um, and if she missed the package of care while it's being arranged, it will be difficult to restart again. It's a very um, uh, daunting process.
Right. I understand your worries,
Mm.
Miss Julie. So,
Yeah.
is there also any other concern that you want to share with me regarding Miss Sandra's condition, apart
N-
from the tummy pain and the bleed?
No, no, it's because this is very new. I didn't see her myself last week because I was a bit under the weather and I couldn't came myself because I had a flu. But my sister is coming and I'm taking the updates from her daily. So I do understand that she's having a lot of things in the background and not everything can be fixed. I do understand that. But today, the pain, the discomfort was really new to me, and I was concerned about the cancer.
Right, okay. I understand your concern, and I appreciate that this have been also like difficult to follow with you. As I mentioned to you, we would consult her gut doctor, and then
Mm.
I'll be able to get back to you with what will be done. But as you mentioned, we will have an arrangement so she could come if there's anything in concern regarding this bleed. She would come back for
Yeah.
any camera tests again to have it arranged for her.
I.
I
Mhm.
have a few things to share with you if you allow me as well.
Yeah.
Based on the condition of Miss Sandra, as you've mentioned, she is frail and she has a couple of long-standing conditions like her kidney problem, her heart failure, and also her diabetes. The medical team has discussed her condition while she was here, and the consultants agreed that she, if things like go worse in terms of her health and she deteriorates, then she wouldn't be for
2 minutes
resuscitation.
left.
So she would be only for ward-based care only.
Hmm. I do agree. I don't disagree with that, to be honest. But the problem is that my family is really big, and I do understand that, but I can't sign this, to be honest. Uh, um, uh, uh, um, 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 my family would be against um, that decision, to be honest. I don't want to take the back heat from the family, but
Right, okay.
myself, I do understand that. I am the
Uh,
lasting power of attorney, and she lives with me. Uh, but yeah, our family is really large, and they believe that everyone should have at least tried with once.
Right. So I understand that this is a very difficult decision. And if you want, we can plan a meeting where like family members could come and we could like let them know why this is being decided. You understand that based on her frailty and the multiple condition, if we do anything to her, it's very unlikely to be successful because she's already very well, and it could also put her in some pain and extend her suffering. So that's definitely, I understand that you may not be able to sign the papers, but that's definitely something I would like to arrange and discuss with others if you want me to. How does
Does
this feel
does
to
the
you?
yeah, does the paper needs my signing, or if the medical team has decided, um, does my signing is needed? Because to be honest, I'd rather not to be linked to this. I do understand it. I do understand that sounding.
Right, okay. I'll have to speak to my consultant whether your signature is really needed. I was told that the medical team, the consultant, have already agreed about that, but in terms of legality, that's something I need to double check and get back to you.
No problem. Thank you,
Oh,
doctor.
okay.
All right. Do
Thank
you
you.
have any other concerns, Miss
No, no,
Julie?
no, no,
All
no.
right.
Thank you.
Thank
Okay.
you.
Thank you, Dr. Lamis, for taking this difficult and lengthy scenario.
It's a very, very
Yeah, even
difficult
the discussion is
scenario.
lengthy and you don't know what's ongoing. But I will tell you what mistakes you have done and
Yeah,
what you
exactly.
can avoid. Okay. Dr.
Right, okay.
Omar will comment first, then I will comment.
What's your name again? It's Dr. Lemis, isn't it? Is that right?
Yeah.
Yeah. So thank you, Dr. Lemis. In my opinion, you've done very good. There is something that would be missed, but we are here to commit those um, um, errors to avoid them. Um, you wanted to encounter this conversation to um, know more, or to make the surrogate knows more, or say things about his mom's condition, but everything has been written there, so you need to use it into your um, advantage. So they have written in the stem, what was written is that for example, the advanced treatment escalation plan is important uh, for discharge planning to restart the package of care. So this is your excuse to discuss this. If you haven't discussed it yourself, I would state it. The doctors won't speak with me last week about something, but I wasn't available. Do you have an idea what it is? So, but you've discussed this very late.
Oh, right, okay.
This is the my main worry. So it's at least in the first 5 minutes, you've already addressed everything regarding the cancer and etc. What you've missed also is to touch base with the cirrhosis um, missing. She has missed the cirrhosis. How Julie is coping with the care of her mom. If you have asked me, I would tell you that myself, I do have carers, as although that I'm the one who's responsible of taking care of my mom, but I do have carers because I had a stroke, which was
Right.
recent. So this is the hidden things that you didn't explore, and this would change the storytelling from the nurse in charge, because in the prompt they're trying to convince you that something has been that she's argumentative, but whilst when you spoke with the simulator, you find that the simulator is very reasonable and very understanding.
Yes, that's what I found out because I was expecting like something
Yes,
uh different. Yeah, so I was expecting a bit of a problematic surrogate, and then it went
yeah,
quite smooth. And it's one of the things that I think I do agree with every point you've mentioned. I think I found the scenario, to be honest, very lengthy and a bit very
Yes,
complex.
and in
And
the exam, they won't, they made it this way. I swear, in my exam 4 weeks ago, the communication scenario was being written in the whole A4 paper, and every details was there. You need to cook up the details, read it very well, who you are, whom you are speaking with, to whom you are, what's the patient name, what's your task, and then try to scan very quickly to understand what's the nature of the scenario. You will miss something. You will miss something whilst you are reading, but the scenario will be inside. I don't think that you would be having time, but this is the game that they are playing. I don't know where you are giving the exam. If it's in the UK, this is the case. Unfortunately, this is what they do. I don't I don't know on the overseas.
Yeah,
Dr.
even
Basim would
overseas, yeah,
advise.
it's
Yeah.
even overseas the scenario like this, it's
they
lengthy,
have, yes,
not
they
that
have
long,
lengthy
but yeah,
scenarios.
but the all
Uh, uh,
A4 paper will be filled.
Yeah, so I think that the chat box is a bit tricky to fit the scenario in a single line. So sometimes it made it difficult to read. I have to acknowledge that I wanted to be honest, I wanted to take a screenshot from how it should be written in A4 paper, so it would be easier to read.
Yeah, yeah,
But one thing I would like to add is that the for the purpose of the DNA CPR, you can whe- when she was asking, "Do I need to be signing it?" No, she doesn't need to be, and this would you can use this to your advantage by saying, knowing that your signing is not needed, would this take give you a relief that you are not being responsible of taking that decision and take the heat away from you? Do you find this helpful? She would say yes.
Right, okay.
So this is a purely medical decision, and we are taking it for two reasons. First of all, the team, the package of care in the community would rather to have an advanced plan to use it in case of if everything went into the different direction, like in stressful situation, they know what they should do. They have an advanced plan. The second thing is that the to use the idea of she's not required to sign. This is a pure medical decision to take off the heat away from her. Just one thing I would like to add. Sorry, Dr. Bassem. I acknowledge that. You can use also a very good prompt or an excuse if you. This is like an extra advice. You can say, "I acknowledge that talking about advanced care plan now is a bit uncomfortable, but it will be more stressful if this conversation happens during a crisis time."
Right, okay. Yes,
You
that's
can
a
use
nice.
this, yeah, as a very good excuse. So you want to, it's been written there in the task. You need to touch base with what's her views on that. In a scenario like this, it would be difficult that you would find that the surrogate is argumentative because there is so many tasks. So he would just need you to touch base on that. He will be saying yes.
yeah. Okay, thank you, Dr. Omar.
Thank you.
Yeah, I can summarize this scenario as I said earlier. Try to write your task in two lines. The first line, the first line is the care or the medical decision about the care, advance future plan, right? What should we do in case her heart stopped? And the second point about the support. What kind of support the family needs or the mother needs. That's it. Unfortunately, Dr. Lamis went to talk about the details, how the mother, how the condition, how. But
Yes, and I
when
think
she
that wasted
starts,
a lot of
yeah,
time.
exactly. When you start to address the main task, it was 2 minutes left about the possible
Yes.
future plan. What should I do, or what should we do in case of her heart stopped? It was a medical decision. Even when you speak about it, you said to him, "We need, or we might need your signature," which is not in the DNR form. Okay,
Okay.
it's not needed at all. We took the decision already decided by consultant in the best interest of her condition, based on her comorbidity, that she might suffer more if we kept her under management, active management. That's why we have decided that, suppose not to give her the maximum care in the form of surgery or even some medication will not help. Instead, we will be sure that we are maintaining her dignity. As you know, the quality of life for such comorbidity will be nothing, or maybe zero, as you say. Okay. Then, based on that, again, in the best interest of her condition, we have decided this decision not to be doing heart massage in case her heart stopped, and we will try to maintain the dignity for her for the last couple of weeks or hours or whatever. But you didn't speak about supposed to speak about this from the start. After
Right.
you told yeah, after you told her about the expectation, what she's expecting from her mother, and what she knows about the condition, she missed a lot of appointment which affected her condition right now. However, the condition now, nothing can be offered apart from the palliative care. I think this scenario is going like palliative or mix between palliative versus end of life. Okay, but the main core of this scenario at the task to speak about DNR. Anytime her heart stopped, we will not do. Instead, we will admit her to the care support unit or the care unit care. The word for the unit care, nothing to be offered more than painkillers, being sure that she is comfort at her bed. If she asks you, please, doctor, can we take her home? You can take opinion from your senior that we can do so or no. If this is one of her wishes or advanced directive, by the way, one of the tasks here to talk about advanced directive, which you didn't
Advanced
do as
directive.
well. Yeah.
I
Did
think
she?
I was
No, no, the advanced plan
just a
is
package of
the
care.
no, no, the advanced plan is the DNA CPR, because the medical team now is have already decided that her plan is to put a treatment escalation toward base care. And the daughter was not there in the previous week because she was ill. She didn't attend, and she didn't attend the discussions that's been made last week. But today, the day of the discussions happening with Julie, the patient is already medically optimized for discharge. She can go home. She's been treated for XYZ problem why she has been admitted to the ward, and then she's ready to go home. She has several things in her medical background. She doesn't have a plan, a treatment escalation plan, which is required by the package of care or the community team who's doing the package of care, the carers, etc. They need to have this paper. So this paper is a part of her discharging process, and she came with a new when she came, she found her mum having new discomfort and new bleed, which is would require just covering by doing repeating some bloods and arranging some scans, and then to jump to the main task, which is discussing the treatment escalation plan. Is that
Perfect. Yeah, that
yeah?
makes sense, really.
Right. I
So,
think yes, this
yeah.
like
So
summarizes
the
the whole
discharge, one
scenario.
of the tasks, Doctor Lami, sorry to interrupt you, but the discharge here, one of your points you have to talk about, because it's also written in your task. Actually, because of a lengthy scenario, I couldn't find this word, but now Dr. Omar is repeating. It's one of the tasks that the patient supposed to be discharged home. Even so, you will ask about the advance directive as any living wish she expressed lastly. You can ask about this, and of course, you can assure that we will try to do so. Okay. The advance directive, as I said, one of the points, because suppose this scenario, one of the important parts to ask about is the advance directive. Lasting power already she was volunteered to say one I'm the one lasting power of attorney. The last point is the support. What kind of support you can offer? You can do any kind of support, emotional or social, or but don't talk about financial support. Okay, who's living with her? Who's taking care of her? Anyone dependent? I don't think anyone will be dependent. So what's anyone needs any kind of support? Let us know. We will try to provide them this.
And if you
I,
ask the surrogate, I'm sorry, if you ask the
yeah.
surrogate how you are coping with your mom's care, she would tell you
Mhm.
that I have a
Yeah.
stroke recently and I myself had a package of care comes to my home.
Oh, okay.
And the mother is awaiting her package of care to be restarted to send her back home. So usually the package of care would be restarted once the medical team declares that the patient is medically optimized for discharge and he's ready to go home, where there the nurses would speak with the discharge liaison officer to restart whatever the patient needs, which would be assessed by physio and occupational. They do the assessment in the hospital, and this is the baseline of the patient ability to walk, to navigate. She can cook for herself, she can make a cup of tea, or she can do whatever she can do. Is she back to her baseline, or she's not? She have a new baseline which requires some amendments and adjustments for which the community team needs to be.
Yeah. Thank you, Dr. Omar. I want add last advice. Whenever the surrogate is talking, Dr. Lamis, please don't interrupt him at all. Let him or let her finish her talk. Once she finished, you can start talking. Otherwise, they can give you minus in the skills of communication that you are interrupting the surrogate or the daughter or whosoever. Okay,
Right.
keep it
Okay.
in your mind. Yeah. Otherwise, you are doing well. You can address any concern, but please try to go ahead to the task once you started the scenario. The
Right. Okay.
expectation, yeah, background of the patient, then start straight away about the task. Here, the mother is suffering. That's why we can finish the management. Then we will talk about the further management in the form of 1 to 3, and the decide by consultant to do so and so on. Okay. Lastly, you can end the scenario by the support, as I said. Okay. Thank you, Dr. Lamis. You have any question?
It's just like a comment. I think Dr. Omar made things quite clear, but I think my main distractor here is the thing that the nurse in charge thinks that the daughter wants to buy her mom more time, and she was like, I was all concentrating on the thing about the bleed and
Mm.
the tummy pain, and because the daughter hasn't been there, so I was expecting something to come up, like from
Uh-huh.
that, like I
But
was
again, the
expecting.
medical decision is far away from this wish, right?
Yes, I
Not,
understand. Yes.
yeah. It's not the patient request or the family request. It depends on the consultant or the medical team decision. That's it.
Right. Okay.
Yeah, and
Yes.
and in my last my exam, there was not a similar exact scenario, just a different scenario. I don't want to ruin the scenario, but I've expected that the surrogate would be argumentative and angry, but he was a British angry when they are very calm,
Right.
raising specific points, and it wasn't as I was expecting. But a bit of advice in the lengthy scenario, try to write to yourself, who am I? Who am I speaking to? Where am I? And the task. Because the rest of the things you have only less than 3 minutes to grasp on. So you've taken the the nature of the conversation very quickly, and you will go straight away rushing when the bell rings. and this scenario will be lengthy. So, and the things that we are not training ourselves on is to summarize things very quickly, and it's not our native language, so it would be difficult. This is the things that they are playing with.
Yeah, exactly. As Dr. Omar mentioned and said, whenever you start the scenario after the introduction, straight away to the task. Otherwise, the time will pass and you will be surprisingly 2 minutes left. What is the task? You will try to hurry up, but no time will help. Okay. Thank you, Dr. Omar and Dr. Lamis. Let's start the second scenario. So
Thank
you're
you,
wrong.
Dr. Ahmed. This,
Yeah. You want
yes,
to add
this is a,
or you ask?
I wanted to thank him because I think this is a very good training scenario,
Mm.
like in the real thing, the real experience, like with the lengthy, you have to work like fast your way through the scenario, know what you're doing, because there are like too many things, and if you drift or get misled like I did, you're going to waste your time and you're not going to be able to complete your main task.
Yeah, supposed to have also many tasks, and you will be unlucky if you didn't start the first task, and of course you will miss the second, maybe the third, if there is complex or scenario. Okay. Okay. Thank you, Dr. Lamis again. Dr. Omar, your scenario is you
Thank you,
are
Dr. Bassem. Sorry, I want to ask one question.
yeah, okay, sure. Let me read the
Uh,
scenario for Dr. Omar. Sorry, Dr. Hosni, right?
I'm reading.
Ale,
Is it the first scenario, Dr. Bassem? The
Yes.
very top. Yeah,
Yeah.
I'm reading it. Yeah, don't
Dr.
worry.
Ala, okay. Sorry, Dr. Ala.
uh,
I will give him just the scenario to read it, and he
It's
will
it's
prepare
it's
himself.
written it's written on
Yeah,
the very
okay.
top. Yeah, I have it. Yeah.
Okay, prepare yourself, then we will
Uh,
start. Yeah, Dr. Ala, you can talk now, please.
yeah, my first question is I want to know more about this package of care because this is my first time to hear about it. It's like only for home care or what exactly? Because it was mentioned also during the scenario from the surrogate. The second one in the scenario, it mentioned in the task, provide reassurance about fitness for discharge. And the surrogate mentioned about bleeding from the back passage. So it's now got, I will be confused. I will proceed with the discharge, or I will tell him that we will check here and we will keep here in the hospital.
Yeah, both questions
Mm,
are good. So the first part,
mm,
package of care, it depends on the patient's situation and the diagnosis. Is it cancer and terminal case? Is it something active to be managed and further management or end of life? It will be depending on the scenario and the condition of the mother or the patient. The second question regarding bleeding rectum or bleeding back passage, it's not necessarily to have further admission after correction of the coagulopathy, correction of anemia, for example. And if they mention that no active management means that they will not interfere with invasive or semi-invasive procedure, so they will just correct the bleeding or the bleeding coagulopathy and the blood by either blood or blood products. Then, if the blood pressure, the vitals being okay, the patient can be going home. And even if this happen again, they will not interfere with this as a further plan. So the DNR means even in the future, if this patient is having active bleeding, they will not activate or they will not even do transfusion. So they will let the patient die in peace. Okay, I hope it's clear.
yeah, it's clear. So we will just proceed with the task
Yeah,
that the patient we assessed here and she is fit for discharge.
exactly.
And we will just follow up and proceed with the other plan to the advanced care plan and
Yeah,
this
which
word
is
word-based management.
yeah, which is
Yeah.
the main task here will be
DNA
DNAR.
CPR.
Yeah, yeah, or DNAR. Do not attempt resuscitation.
Resuscitation.
Okay. We have another question from Dr. Husni. What the source of these cases? Is it from a recall exams? Yes, or from certain books? I don't think they are from book. It's real cases or scenarios from the exam recalls from other different centers. But to be aware about all the ideas, read the books. As you see, Dr. Hosni, this scenario is going for the direction of DNAR. You will find in the book how to talk about the DNAR. Whatever the scenario, the idea, the concepts will be the same. Okay, the story will be different, but the main task the same. DNAR, palliative or end of life care. Other than this, you will not. And the same idea of the address, the concerns will be the same. Support, not to activate any management for the patient. DNAR, as we mentioned, the advanced directive lasting power of attorney. Okay, be sure that you cover these points and you will be covering the all tasks. Okay, anyone has other question or comment? So I will read the scenario quickly before Dr. Omar will start. The second scenario, Mr. Paul Smith, 35 years old, has been admitted with a drug overdose, which has been assessed to be low risk. He has history of chronic hepatitis B viral infection. He is on tenofovir once daily. He missed his last two follow-ups. Recent liver function tests are abnormal. Viral load more than 6,000 international units per ml. You are the doctor in the gastroenterology clinic. Your task is to explore the patient non-adherence, explain the importance of adherence to tenofovir, potential side effects, and the risk of hepatitis B complication. It's clear and straightforward scenario, Dr. Omar. If you're ready, we can start.
Yeah, just 30 seconds, 1 second.
It's okay. Yeah, I can ask from other candidates, as I can see, yeah, a good number today of attendance. Try to write in the chat box what you should talk about in this scenario. And briefly, I mean just words or two words, like a sentence. What task you have to talk about? How you can do this scenario if you face it in the exam? And I will request from Dr. Omar not to look at the chat box as usual. And we'll see who covered the all task and who did the scenario well as ideas or points to be mentioned. Okay. Maybe we'll put a gift. The one who covered the points appropriately, he can have opportunity to practice this week or next week or whenever available. And I need, without looking to or searching in any website, what could be the side effects of tenofovir? Where the scenario, Dr. Shema? Okay, I will share the scenario now. Then you can write after that. Yeah, I like to be the decision interactive. So feel free to comment or to write. And again, Dr. Omar will not look at the chat box.
I'm not looking. I'm looking to the scenario on the top.
Okay.
Yeah.
Okay. Yeah. And ready?
Yeah. Yeah.
Oh, here you go.
Sorry. Hi, hello. My name is Dr. Amar Malta, doctors here at the clinic. Welcome, Mr. Paul. Can I ask you to confirm your age, please?
Yes. I'm 35 years old, doctor.
Hi, Mr. Paul. So, I've read a bit about your why you are visiting us today, but I would like um to know if you have um to be honest, I have few tests results in front of me. Would you like to start by discussing them, or you want to something that you can um, do you prefer to start with by discussing
Yes, I'd like to go ahead and
the
answer.
results? Yeah.
Yeah.
So, mhm.
Yes, doctor,
Okay.
I'd like to go ahead and
So you do understand that you have a viral infection in your liver, is that correct, Mr.
yes,
Paul?
I do,
Yeah,
doctor.
yeah. And the viral load or the actual amount of viruses in your blood came back a little bit high. And are you following me,
Yes, I am,
Paul?
doctor.
Yeah, yeah. Also,
I'm following, doctor.
you've
Yes, I'm
missed.
following you.
Yeah. Also, you have missed the last two follow-up appointments. I would like to check um on you in general, how you are doing, how you're coping with the medication.
Right, doctor. So this is something that I've been expecting. Like, I'm not really surprised that I wasn't expecting my blood test to look good.
Mm,
And I'm going to be really honest with you. Things have been very difficult for me lately, and
okay.
I had some
You,
trouble like to attend my last appointments.
is there anything that I can help you with? Whatever you would say, it will remain confidential, and I'm here to help you, to be honest, Paul. Um, if you would like to share with me what sort of difficulties that you are across or that you are coming across, so I can do my best to help you.
Right. So thank you, doctor, for offering me this. I'm not really sure if your help is going to like do something, but I've recently lost my job
Hmm.
because I'm required to do some like regular checking of my blood. So for like hepatitis and HIV, and then once like my blood test came back positive, basically for hepatitis B, I have lost my job,
Okay.
and ever since things haven't been really good for me.
Yeah, it is really distressing. I'm acknowledging that. I'm really sorry that you're going through that. But what sort of jobs that you are doing, or you was applying for, Mr. Paul?
Right, okay. Actually I was doing phlebotomy.
Okay, it's very understandable now. Yeah. Um. Yeah. So, s- be having phlebotomy job is basically um including needle insertion, which is could be a problematic and should be it has its own standards, and it's understandable why they will not um uh they basically it's understandable why they will test for the hepatitis. Do you understand why?
Yes, I understand, doctor.
Yeah.
But it's been very like frustrating for me. The loss of the job, haven't had like any savings, and Um, I have to be very honest because I came here like to sort out my problems and see how I'm going to take this next. But I was feeling quite low, and I've been like to a few parties, and basically I've used some party drugs, and
Yes.
that's the reason why I came here in the first place. And then
Mm-hmm.
part of it, like they did the blood test because I haven't been following up the past like two appointments.
Mm.
So I know it's a bit of a difficult situation, and I really don't know what I have to do next.
Yeah. So for the first concern about the job, we can sort this out by signposting you to the relevant team who can provide assistance on job application and what sort of job that would suit you. But the second important thing is that your viral load that's been very high, and it has something to do with you taking the medication. You've been honest with me, and I think that you've said to me that you don't take the medications as regular basis. And the third problem is that you're feeling very low because what's going on um, uh, around you recently, and you've been admitted because of an overdose. Is that correct?
Yes, that's correct, doctor.
So, what type of drug that you've been taking?
I'm not really sure, doctor.
Okay.
I'm very recent to these things. And it's just something that people have been using.
Do you share needles by any chance?
Um, well,
I'm sorry to ask this. Yeah, it's just a typical question. I'm really sorry. Yeah.
right. Well, I don't think it makes any difference now because I've already had this hepatitis B anyway.
Well, it's sharing needles would also come with risks to have other viruses like HIV, HCV. So having one virus is one problem, but to add to them other viruses is would make things worse. But also you need to um we need to contact also um the people who might be at risk of hepatitis B also from your side.
2 minutes left.
Are you
Right.
following me,
Okay.
Mr. Paul?
Yes, I am following you. Right.
And are you sexually active?
No, I currently don't have any partner.
Any partners in the last 6 months?
No.
No. Okay. On the other hand, what I wanted to talk with you today about is um the adherence to the medication tenofovir. You don't take it? Is there any specific reason why you don't take it?
Well, doctor, I was told that the medication is not going to cure my hepatitis B anyway, so I see no benefit from taking it.
But it's important to keep controlling the virus amount in your blood, which will decrease the amount of the side of the consequence of having it. Are you familiar with that consequences?
Right. Yes, I was told about them in my last appointment.
Yeah, cancer, spreading of the infection within your liver would lead to basically fibrosing the liver. You will need um, building some fluids in your body, which would affect your well-being in general. So, are you keen to take the medication now?
I think yes, if I find like some help and support, and if you can solve like the appointments for me, because for now
Yeah,
I'm not
yeah,
able to come to my appointments. If we can like
we will
fix it,
schedule.
then
Yeah,
I think something really willing to
we will
explore.
we will schedule the appointments again. I think time's
Right.
up.
Okay.
Yeah, time's up. 10 minutes now
Yeah.
exactly. Okay. Thank you, Dr. Omar. It's another also complex scenario. We will talk
Hmm.
about the task here in this scenario, but Dr. Lamis will comment, then I will comment.
Yes. So I think it's a bit of a complex scenario because of the nature of it is because you don't want to start like discussing the drug overdose and things. You want to explore what the surrogates knows and how they would lead it. So like they gain your trust, and Dr. Omar did very well to ensure the confidentiality. And then after that, the surrogate was willing to open up and speak about how he's been sharing needles, how things were on the low side in his life, and he sounded like very depressed. So I think that's something that took a bit of time, a bit of time to discuss. So the reasons for non-adherence, as soon as the questions was asked, and that was based on this report that Dr. Omar was able to build. The surrogate was willing to say that he's not willing to take the medication because he doesn't see any benefit because it's not going to cure his liver problem anyway. So one of the other things that was on the scenario, and I think Dr. Omar did not have enough time, was the side effects part of the tenofovir. And the surrogate here is going to express a concern about the renal toxicity and is going to say, yes, I've been told about this before, and this is one of the reasons I've already have problems with my liver. I don't want to end up with a kidney problem as well because they told him about the renal toxicity last time. And the other last thing, like two last thing on the social is the alcohol, because he was also taking alcohol, and that was something we needed to advise. Again, it's because of the additional liver damage. Yes, it was just one thing on the social, the sexual activity and protection. Dr. Omar covered really well. It was just the mental health support. I'm seeing things, acknowledging how difficult things must be. You seem to be very low, and also addressing the drug. How about some help? We may offer you further support. We can refer you to a mental health specialist or the mood doctor who's going to be in a better position to offer you some support. You can speak about how you feel about your diagnosis, and also if there's anything else, then further support would be offered to you.
Mhm.
Otherwise, nothing else.
Yeah, thank you, Dr. Alamis, for the scenario. It's a high yield scenario, by the way. Non-compliance to a medication.
It came in diet 3,
Yeah,
and it came in many of the overseas centers, I
yeah.
think Pakistan and India.
You know why? Because it's a tricky one. So there is a lot of points here, and as I said, it's a complex scenario. The main task, I can say in brackets, non-compliance to the medication. How to do the scenario in this with this task. This is the main task. Why this patient is not taking medication? Why he's reluctant? I should convince him to start the medication. I should give him ideas and seriousness about having non-adherent to the medication or being non-adherent to the medication. What could be the future disadvantage or drawbacks of not taking this medication? And the social, the support. If he has low mood, we can, as you said, refer. If he has any problem with the job, we can refer, or we can address the job itself, reallocate the job because he's having risky job. And the alcohol smoking. These, in summary, what I mentioned, you have to talk about. So let's talk about Dr. Omar, the performance. He started like hesitant how to start this scenario, right, Dr. Omar? So
Yes.
yeah, so you have to be, as we said, straight away to the task. Ask him about his knowledge, what he knows about his condition, what the expectation of why you are sitting here today. Do as we are doing in any usual scenario. But you were reluctant how to start. Should I ask him for concern and I will address concern by concern, or I should talk about the medication non-compliance, then I will convince him, and you wasted the time about 2 minutes. You don't know what to do. Anyway, the introduction, if you want to confirm that he's having the good capacity, you ask about the age, which is good question. You can ask also, how are you? Where are you today? And what time is it now? For example, for the orientation, if you want to assess the capacity, as he has some suicidal thoughts,
Mm-hmm.
then what do you know about your condition? I am having this hepatitis infection. I am worried. What's the expectation? Why you are here today? What the ideas of our meeting today? Yeah, doctor, I think maybe because of something result have been released. I want to know about them. Now you can do it as breaking bad news. And it's really breaking bad news. The patient having viral load more than 6,000, like relapse. What could be the outcome of this relapse? This patient, he might have reactivation of hepatitis B and the drawbacks of hepatitis B, the chronicity or cirrhosis or cancer, hepatic cell carcinoma, chronic liver disease, end-stage liver disease, and finally the failure or hepatic failure, which can lead to affect or can threat his life, right? In this way,
Yeah.
yeah. So later on, you can address other things. I will tell you about them later. But in this way, so he will say, Doctor, okay, what should I do? Now you can address why he's not taking the medication. After breaking bad news, yes, and the fate of virus if you didn't take the medication and the seriousness. May I know for what reason you are not taking your medication? Doctor, I have low mood. Okay, address this one now, right now. If you have low mood, we are here. Don't worry about this. We will support you and reassure confidentiality, as you said. You can reassure confidentiality earlier at the introduction. Okay, whatever you want, we are here. We can call the mood doctor. He can sit with you. He can have a talk with you to address all your life or your social support or your social issue. Whatever you have, he can solve it for you. Anything else can I add this for you? Yes, doctor, I forget the medication. Okay, we can have the application or we can give you alarm system to remind you to take the medication. Okay, finish this part. What other points you have to raise with me? Doctor, I'm afraid of complication like kidney toxicity. Okay, don't worry. We are here. We are supporting you. We can give you a lot of follow-up with our kidney doctor, and we will do monitor for this level of the kidney function in order not to have this toxicity or
Mm-hmm.
side effect on your kidney. So it's a matter of addressing why this patient not taking this is the main task in this scenario. Okay, I think you went to the suicidal part rather than the part of non-compliance to the tenofovir. Okay, you finish all the points why he's not taking the tenofovir. Now you start to ask about the alcohol, about the smoking, about the job. As you address the job, he's doing as I think phlebotomy. He's a
Yes.
nurse. Yeah, yeah. We can call your
A
supervisor.
phlebotomy.
Sorry.
He's just doing phlebotomy. See, one of the things I think because Doctor, I noticed Dr. Omar, he was like calling the surrogate name Paul twice, and it is in their exam. They said the surrogate were instructed to
Dr.
be
Lamis, your voice is very
non-reactive,
interrupted.
Yes,
so
your
it
voice
would
is
feel
breaking,
like they're
Dr.
not
Lamis.
in that part.
Dr.
Dr.
Lamis, can you repeat the last two or three sentences because we
Sorry
didn't
about
hear
that.
them?
Yeah, it's breaking little bit. If you can fix it or you can
Right, sorry about that.
okay, you can
Right,
talk now. Okay,
how
please.
is it? Maybe I can just change my position. Right, am I audible now?
Yeah,
Is
yeah,
it clearer?
yeah, clear, yeah.
Right,
Yeah,
okay.
yeah, clear. Go ahead.
So yes, sorry about that. So the thing is, I was saying, Dr. Omar was he was calling the surrogate's name like twice. Paul, are you following me? And this was one of the things, like the person who did this on their exam, they said the surrogate was instructed to be like very low, very sluggish, very non-reactive. So this interrupts the flow of the conversation, but that's the part of it of the low mood. So as soon as you fix the low mood in the beginning of the scenario, then the surrogates becomes more
Interactive.
reactive, yes, and more interactive with you.
Okay, so another point in the communication skill. But I'm talking again about the main task here, which is the non-compliance. Let's resume our communication, the performance. Uh, I don't know why you raised the issue of sharing needles. It sounds like you are taking history, which is not allowed. If you want to give some instruction, some advices, you can tell him at the end, please be sure that you are not sharing needles with anyone and you are not having unprotected sex with your partner in order not to spread this infection to others, not to be donating blood, not to be doing risky job, not to share tattooing or do tattooing for anyone or doing tattoo itself or as I
Yes,
said,
but
yeah.
to be honest, I asked it because this patient is been flagged to that he has tried drugs. So one of the method that he would try drugs that is sharing needles. So I found it to be reasonable to ask about this because this could be one of the hidden or one of the risks that needs to be addressed is sexual activity,
Oh,
sharing needles in hepatitis B scenarios that usually should be covered. This is
okay.
why
Yeah.
what's my understanding of it.
Okay. Yeah, yeah, yeah.
I'm flexible to
I got your point, Dr. Amr. Sorry to interrupt you, but what the benefit of knowing if he shared needles in in the past? Now we are talking about the current and the future. If you want to or to address, just give him advice not to have it in the future.
because he
He
has
already,
recently been admitted with a drug overdose, and yes, it's been addressed and it's low risk, but I don't know what sort of drug is it injectable drug that he's been taking? Is it whatever drug that it's been that he's been having? He's having some risky behavior, so this is why I felt, but what I felt at the when I did this when I was simulating the scenario.
yeah. Okay, but if you refer him to the mood doctor, he will address it issue with him. So the mental health team will address this part if he has low mood in order
Mm.
not to try again or to have another attempt, they will do so. Okay, by the way, you will not, if this patient asks you to be discharged, you cannot discharge him unless will be seen by the mental
He's
health team.
yes, but
Okay.
he's already seeing me in the clinic, so he's an outpatient. He's not admitted. This is so when I wrote that when I read the task I did understand that he is in outpatient service, outpatient clinic. So I've excluded the discharging debate scenario from my mind.
Yeah.
And he had um, a recent admission for an overdose, which has been assessed to be low risk, and then the main problem was coming with test results. So I started by discussing the test result and was waiting if the candidate wasn't opening. So, oh, okay, so this is a low mood scenario. This is what was going in my mind. So this is why I wasn't 100% sure.
Yeah. But the main problem here in this scenario, the patient is not taking the medication. That's why he has high viral load,
Yes.
and you want to address this part. So go ahead with this part. If you want to do anything else after that, you can do. This is my point and my advice,
Yeah.
not to
Yeah. Yeah.
take
Yeah.
it
Yeah.
as a first task. Unfortunately, you start to address these parts and you address the tenofovir at the last 3 minutes. And they didn't compliance. Even you didn't ask him why you are not taking this. He said to you, I'm afraid there is problem in my kidney. But I didn't hear you addressing this point. How you can solve this point with him? Why he's not taking it? And did you convince him to take it at the end? Is he agreed to do this to do so? Did you
I
ask
asked
his
this
opinion? Yeah.
question.
Yeah.
I asked this question, Dr. Lamis, did I?
Yes, he did. He did ask the questions, just like if you allow me, Dr. Basim. So Dr. Omar is right. So the problem of the overdose of the patient has been there, but it's not his main admission right now. Like he was in the hospital, but then he was referred to the gastroenterology clinic. So that's something definitely Dr. Omar needs to touch on. And you need to offer the mood doctor not because of the current like drug overdose, but because this is one of the hinders to your drug compliance. Like if you don't solve the underlying mood problem, then most likely your patient is not going to get their medications because they're already like having some struggles.
Mm-hmm.
Yeah, this is my point. He has low mood. Maybe because of low mood,
Yes.
he's not taking this medication. So you have to refer him and to address this part to solve his social issue. If he has any financial support, does he need or anything in his job, occupational issue, or something with the family? This is my point to address it to correct the
Yeah.
problem, the main problem, which is the non-compliance. But it's not the main task here about the overdose. As you said,
I,
it's low risky one, and it could be at the end of scenario you want to address it, but not as the main task. It's
but
not
I
suicidal
did.
attempt scenario.
Yeah, what I done, if you've been listening, so you will be having a better judgment than myself, to be honest, Dr. Bassem. When I was addressing, I was trying to understand where's the problem of non-compliance. It wasn't was the problem is that he's low mood, so he's committing, he's in putting himself into taking drugs, and because of the pressure of not having job. So I've addressed the job by referring him to the relevant team, so we can find a suitable job for him, and then his compliance problem. I started to talk about it when it was, I think, 6 minutes, and then toward the end. So I was trying to understand why this surrogate does have a compliance issue. In I think the before starting addressing the compliance, I touched base with his drug overdose very briefly by asking that what type of drug, where the surrogate told me that I don't remember. So I got the feeling that we should skip this. So I skipped it very quickly, um, uh, uh, and then jumped to the next problem. So I was trying to understand why he's not being compliant, because it's not a direct question. I feel that if I asked him directly why you haven't been compliant, it's an interrogation way. I was trying to clarify why he's not been taking the medication. But do you think that this wasn't the right approach?
I think so. It's clear and straightforward that we should address the compliance or the non-compliance reason in this scenario. Why you are trying to approach him indirectly?
Because
Why you are
this
not?
is
Yes.
I felt that this person is having a problem. He's not will not open straight away, uh, um, because of the nature of the scenario. Someone who has been recently discharged because of a drug overdose, and he has already a hepatitis B. When I asked it earlier, I noted that he had a pressure from being rejected or dismissed from his job, so he has job pressure. So I provide reassurance straight away that whatever you would say is confidential, trying to explore more risk factors or risky behaviors
Okay.
that he's doing. Then okay, this person needs help. But this was
Okay.
the my
If you
my
try,
approach, but
yeah,
it didn't sound
yeah,
coherent to the
this is
listeners,
what I
which is
want to say.
important.
Yeah, you didn't show that it's very important for me to convince this patient by the end of this meeting This patient should be agreed to take the medication back, to have reschedule for his appointment, and we will follow up him with the group of doctors, including one, two, three, the social support, the occupational, and sorry, for the personal regarding the smoking, the alcohol. The alcohol here is very important. It's something crucial you didn't
Yes, I missed.
touch. Yeah. Yeah, what I want to say, make your approach organized and you will not miss anything. In this way, the introduction, the idea, the breaking bad news, or the whatever it's the task, then straight away to the task. I should address why this patient is not taking, so I will ask him directly after confidentiality reassurance, the question, the concern, why. If he open up all of them, yes. If not, I can ask about the social, I can ask about the personal, about the occupational. Then he might open up again in this part during the discussion. Then at the end, I can ask for the tone of affair if he knows more about it, anything he's concerned about, and the closure of the scenario. Thank the patient, and this is my favorite one. If you have other, let's read the comments in the chat box. Uh, what ideas can be offered in this scenario? Okay, you have any concern, Dr. Omar, or you have the other comments you want to add?
No,
No
no,
question.
no.
Okay. Don't be feeling down. You did well. Maybe I
Uh,
didn't
n-
hear well
no.
the
I,
conversation.
I'm not feeling down. No, no. It's very
Mhm.
important that we do those
Yeah.
things here. I'm not feeling down. Alhamdulillah. Yeah.
Yeah. Okay, good. Let's go to the comments. Dr. Ala, talking about the overdose event and confirming the low risk of recurrence. So, but yeah, either direct or referring to the mood doctor. Asking about his knowledge about hepatitis B, perfect. Exploring why not coming for the follow up, perfect. Explain the risk of chronic hepatitis B without treatment and the all complication expected. Explaining about the medication, side effects, GI disturbance, nephropathy, social question, especially alcohol. Perfect, Dr. Ala. So all points should be raised. Dr. Ashema, explore why patient not adherent to the medication, explain the risk of developing liver cirrhosis and the complication like short of breath due to volume overload, bleeding tendencies, all chronic liver disease you mean, risk of hepatocellular carcinoma. I'm not sure about tenofovir side effect. This patient seem depressed, try to see any stress at her life. Perfect. So yeah, the same ideas you are talking about the side effect of tenofovir, any medication you want to mention or to explain to any patient or to counsel, you have to mention the side effects, the common one. What if you didn't talk about the side effect and he will come back with kidney failure, which is he's worried about? You will be in trouble. You didn't mention them. If you don't know, is another issue. So you can arrange another meeting with him to explain in details what the side effect of the tenofovir. Perfect, Dr. Shaima. Good comment. The last one, Dr. Hannah. Reassuring him regarding the overdose of drug is low risk. And then start to explain the main issue, which is hepatitis B virus, and asking about follow up and the medication compliant. Explain the importance to take the medication and different regime of treatment. I don't remember it now, but I think if he is good compliant, I think there is to be better to change. No, doctor, if not written to change, don't erase this point at all. No need to change unless written for you. So whenever they mention tenofovir, talk about tenofovir. Explain liver failure and complication, which is cancer, then social, especially to stop alcohol and job. I think all of you agreed and collectively you are talking about the same concepts, which is perfect. I think also Dr. Omar did it, but in indirect way. He focused more on the suicide attempt and he tried to know why and what's the other risk habit he's doing, which is not our task clearly. You even ask about screening other virus, other people, which is not our task. We are here having this patient in low mood, non-compliant to medication. how I can take care of the people who's having contact with him. I want to convince him first. Later on, I can see who's else affected or having contact with him. You got it?
Yeah, for sure. Yeah,
Yeah.
but uh, usually with hepatitis B, there are certain of things that you need to ask. This is why um
I
uh,
agree, Dr. Omar, by the way, but you
this
have
is
to finish
why
the task. You
yeah.
didn't do the main task. You finish the task at the end. I prefer to do the task earlier at the beginning.
Hmm. Yeah. Yeah,
Later on, you can talk about other things. If you fulfill the all task,
hmm.
yeah, okay,
Yes, for sure. Yeah. Mm.
okay,
Can I just add one simple thing, if you
okay,
don't
Doctor.
mind, Dr. Bassem?
Sure, Doctor.
Just Dr. Omar, يعني I felt sometimes if you put in your mind something when you are practicing, it will help you too much. Those scenarios are always, there is what we call like information which is secondary and information which is primary,
Primary.
your primary priority. Always use the task to guide your mind and to guide your scheme to arrange the priorities. In case I want you to concentrate on the previous admission and on the social support, I would tell you in the task, please explore the risk factors and address the patient's needs. Okay? And then look into whatever related to his hepatitis. The task is always helpful in arranging our priorities because it's not only you who will fall in this mistake. The surrogate will push you to fall in it. Even if you arrange your task and you arrange your paper, when you will go inside, the patient will give you clues and will start with the concerns, which will make you or drive you away from the task. And just to make sure that as a doctor, you will stick to your scenario or you will be easily deviated and follow the surrogate. For sure, we will try to contain the concerns of the surrogate, but we will keep everything in the frame. The bigger frame which will guide us is the task. So when I look at the task and I see that the adherence and the hepatitis B is mentioned in the task, then I will use the remaining information to help me in my main task. Here from this scenario, I feel that they only brought for you the previous admission to show you that this patient have a route of the route of transmission for hepatitis B is IV drug abuse. So they reveal for you the risk factor. The second thing that this is regarding the risk of transmission from where he got hepatitis B. They gave you the answer as a gift. And the second thing, the compliance mostly related to his mental health problem. So the capacity is very important in this scenario. Okay? Because any patient with drug overdose, usually we question his capacity. And capacity is very, very important in any scenario of compliance. So I will put my main task is hepatitis B, tenofovir, and the compliance. Then I will put between two brackets, the mode of transmission is IV drug abuser. So I should concentrate on the point that if you continue to use drug through IV route, you might not get benefit from the treatment. This is the only information I should deliver, at least from my point of view, before I go inside and listen to the patient concern. Second, the patient mood, the patient mental health, the patient capacity based on the information I recollect from him from his previous admission. So I will try to ask him to summarize at the end, and I will ask him every now and then, can you follow me? Are you able to tell me back what you have got from our discussion? Am I making sense? Is it making sense to you? Are you willing to become compliant? Just to get any information, how much he is retaining and whether he's able to weighing the risk versus benefit based on your discussion. And not once. In such a scenario, I will not wait till the end until I ask him to summarize. Because usually, if it's a pure scenario of compliance, and they didn't mention that the patient have issues with overdose, the first task is to confirm his capacity, because I cannot convince a patient who have a problem with capacity and he's not convinced about medication, okay, or he have a mood problem, or he is depressed. So in that scenario, without any clue about the patient mental health, I should confirm capacity multiple times. So I feel here it is like more compelling to confirm this multiple times during discussion and not to leave it till the end. Okay, so my يعني the end result from the whole discussion, the primary information you will get it from the task, and then you will use whatever mentioned in the scenario to support your task, and additional information later on. Maybe it's given as a clue to give a patient an advice. Please, if you will continue to administer the drugs through the blood channels, there is a big possibility you will not get benefit from the drug, and the virus will remain active and you will sustain more complication. Not to mention that you might harm people around you. Okay? So, but I agree with you that in such a situation, I should have a very good introduction. The only thing which will change my scheme in such a scenario, that my introduction will contain emphasis on the confidentiality. I will emphasize on the confidentiality, and I will be very gentle with this patient. How do you feel now? Are you feeling okay? Okay, do you want to share anything with me before we start? Be sure that everything will remain confidential. I will not invite anyone to the meeting, okay? And that those extra steps, I will add them to my scenario in view of the information provided to me in his previous admission. That's what I wanted to say. And this you will learn from practicing.
Yes.
Usually, whenever we see any scenarios or we start to
Mhm.
practice communication, we mix up why they
Yes.
gave me this information, what I should start with, what is
Yes.
more important in this scenario, what is the aim of mentioning this sentence. So we will make a lot of mistakes. And believe me, even I'm commenting, Dr. Basim, anyone is commenting. In our beginnings, we used to mix up things. But
Yeah.
with time, you will learn how to
Exactly.
being strict to the task and use the other information to support the task. But whatever will guide your start, you will give it 2/3 of your time, is what is mentioned uh,
Yes.
in the task. And believe me, even you will do this, the surrogate concerns will distract you. So if you didn't start with the task from the second minute,
He
you
will
will
distract me.
yes, you will be easily distracted, and
Yeah.
the time will pass, and you
Mhm.
will feel that you didn't get your chance. So if at least you can give yourself the first 2-3 minutes
Exactly.
يعني for the task, and then
Yeah.
the surrogate will start distract you, and
Yeah.
you will start to, do you know, bring him back and gently. But
Mhm.
if you lost the first 2-3 minutes, then it will be difficult to find, like,
You will be
you
even
know, on
panic, Dr. Hind. You will be panic.
I agree
I
with
want
you,
to, yeah.
because from one concern to the another to the
Yeah.
other, you will feel that you are very in too
You
much
are
away
lost. Yeah.
from the main task, and you didn't check capacity. You didn't
Mhm.
give your time, give time for the patient to confirm how much you got from you
Yeah.
early. So try, especially with some scenarios, they are very strict. Whenever it's a compliance scenario, capacity scenario, they consider if we didn't deal with it properly, a major mistake.
Yeah.
So take care of the compliance scenario, overdose scenarios, committing suicide scenarios. If there is any issue of mood, depression, always try to practice those very well, because يعني the capacity problem, it make us lose a lot of marks whenever it's a scenario of capacity, if we don't check it like regularly and start to apply our task early. Because يعني your scheme need to be applied from the second minute, from the third minute. Some scenario when it is about disease counseling,
Yeah.
You will have a lot of chance all through the scenario to apply your task. First 5 minutes, second
Yeah.
5 minutes, disease counseling. For sure, whatever you mentioned during the 10 minutes, you will get 14 mark, 12 mark, you will get something.
Yes.
But whenever it's about capacity, if you didn't start work on the capacity confirmation from the second, third minute, يعني the examiner will consider that this is a major mistake.
Mhm. Yeah, not only that, Dr. Hind, if you start to listen to the surrogate, as you said, if you give him the time to speak, he might give you gush of the concerns, and the task may be lost or missed. At the end, 2 minutes left, you might start now to talk about the task. And as I said, you'll be panic all the scenario. You cannot try to deviate him back to your task because you are trying to address his concerns, and it wasn't the time to ask for concern now. Anyway, it's good, really good advice. Thank you, Dr. Hind. So you confirm what we have to do in this scenario, and you address it in good way. And the advice here, frequently practice, will help you in the future to know
Yes,
what's the aim of this scenario.
how to deal with them. And
Yeah,
don't forget always something like red flags.
exactly.
Always
Yes.
red flags are important.
At
So
the
here,
closure.
since it's a blood transfusion, if it is a blood-borne viruses, there is
Mhm,
a set of red flags, and you
mhm,
have to always keep in your mind that the patient might either make a mistake regarding his medication. So if he didn't take it, or he take an overdose, or
mhm,
the disease become active because he's not compliant, so you should tell him at any time you feel yellowish discoloration of your skin,
mhm,
tummy pain in the upper part, if you felt nauseated, vomiting, please immediately approach us. If you know if you felt any loin pain, because tenofovir, especially the tenofovir, the old formula, not the alfentanil. Alfentanil is kidney friendly, so it will not cause renal stone. But I remember tenofovir is very known for its renal stone complication. So here they didn't specify the formula. So you can tell him generally if you felt any
yes.
burning micturition, if there is any gravels, or if the
Mhm,
urine become not pure, please immediately come to us. So the medication red flag, the disease reactivation red flags, and the blood-borne viruses red flags. Sometimes red flags are not only one red flag. It's sometimes more than one. So please come back to the ER if kaza 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 happened, whatsoever you enumerate, and please don't donate blood. Don't use sharp objects or share
yeah.
sharp
Don't share
sharp
anything.
objects with anyone. If
Mhm,
she is lady, pregnancy is very important. Okay,
yes.
and emphasis on follow up and compliance at the end, and then the final part will be summarize. Even if even if you didn't get time or the time ended, but you verbalize, can you please summarize how much
Mhm,
you got from our scenario, and
mhm,
you have already checked multiple time, you are
mhm,
saved, you are
yes.
done. And there is a very nice also part in compliance. Always divide compliance to patient related factor, doctor related factor, treatment related factor. So you should ask first the patient, did anyone educate you about the disease and the drug? And are you informed that you need to follow up regularly, to emphasize on the side effect, to monitor you? This is what we call doctor related. So I already educated my patient about all the needed information. If the education part is not done, this could explain why he is not compliant. If I don't know what is the benefit of the drug, if I don't know how it will alter the outcome, if I don't know what will happen if I didn't take the drug, this is a doctor related factors. Patient related factor, memory, lifestyle, shifts, not sleeping well, drinking alcohol, not he's careless about the follow up. So I need to correct his misconcept. So it's patient related. Medication related, side effect causing renal stone, multiple UTI. The patient will not take the medication. Big tablet, complex regimen, okay? Side effect from the coating. Okay, so these things or side effect from the medication itself, or مثلا the drug causing diarrhea whatsoever, discomfort. So always, if you divide your scheme from outside, that I will start pointing at education, then pointing at the patient life, social, alcohol, smoking, compliance, memory, life routine, then I will target the drug. And for sure, the concerns, the correct concerns, will raise up. Yes, doctor, I get multiple UTI and admissions. Yes, doctor, I have night shifts. The tablets is big. The regimen is complex. Nobody educated me in asthma scenario. At the end, nobody told me why I need two inhaler. Why one is brown and why one is blue. This was the whole concern. He said I was confused. I don't know what is the benefit. I was taking just one. So at the end, it was a doctor related factor. The patient is ready to take them, but nobody educated him very well. When you will tell the patient about the usefulness and the difference, he become very happy. Oh, okay, this is the reason now I will take them. Now it makes sense for me. So it's an education issue. So just divide the compliance into these three categories and you will pick the correct concerns quickly. Then you can keep the door open for the patient to raise any other concerns, any social issue, any difficulties, any struggles, which you couldn't pick. Okay? I hope this was helpful.
Yeah,
Yeah,
too
it
much
is. What
helpful.
was really helpful. It was really, really helpful.
Thank you.
Medication.
Yeah, thank you, Dr. Hind. Any question, Dr. Omar or Dr. Lamis?
No, it's just to summarize what's for myself, at least. So for the compliance, we can address the capacity if the patient is competent straight away from the start. We will try to reassure and give confidentiality if the scenario is going as it's gone today, and then understand why he's not compliant. And for that, I think Dr. Hind provided very coherent three possible reasons: doctor-related, patient-related, or medication-related. This could be the potential causes of non-compliance. And then whatever the patient concern is going or is heading then toward the end is the safety netting and asking the patient to iterate. To be honest, in the exam, you wouldn't find time to ask the patient to um, um, uh, say again or summarize the facts again. And what has been advised here, don't ask the patient to summarize in the new scheme of the exam, as if everyone has done the same, the candidate will lose everything. Not the candidate, I'm sorry, the surrogate would be exhausted. So it was very, very helpful advice, to be honest.
Okay, thank you, Dr. Omar. Yeah, you will get a lot of experience with the practice, of course.
Yeah.
At the end, I will thank Dr. Lamis and Dr. Omar. One sentence I want to add: Dr. Ala, Dr. Shaima, Dr. Hana, they were well done in their comment. So I offer them a priority whenever they want to practice. It's my pleasure to give them the opportunity. Three of you, because they were too much interactive and all the paragraph they wrote was to the point. Thank you again, Dr. Omar, Dr. Lamis, Dr. Hind, and everyone for the attendance today. See you tomorrow, inshallah, with a short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa
And
barakatuh.
thank you, of course, Dr. Bassem, for organizing and arranging all of that. To be honest,
Thank you.
God bless you. And
Thank you, Dr. Omar.
let's,
Most
yeah,
welcome.
inshallah.
You're most
Thank you,
welcome.
Dr.
Thank you.
Bassem. Thank you, Dr.
Thank you.
Omar. Have a good night.
Thank you. You too.
Thank you.
Thank you.
Thank you, everyone. Thank you. Good.